Let's start the afternoon session. What we're going to do is we're going to start off with brief presentations by people who are affiliated with 5 kind of working groups, and we'll have those presentations, 10 minutes each, with co-presenters who will divide the time, the 10 minutes as they choose, and then on the end of that, we'll then channel people into kind of 5 different groupings. 3 of the groupings here in this room and 2 of them downstairs. So let's go forward. The first grouping is religious and ethnic identity, and that will be with Dr. Ghazala Mir and Shenaz.
Right, thank you. So Shenaz and I are both going to talk about how we have used research in our own work on ethnic and religious inequalities to influence social change. And I'm going to tell you first of all about 2 methods that I've used, 2 research methods that I've used that I think can influence social change at the same time as providing reliable evidence for service development in health services. So the first project that I'm going to talk about is a project that used participatory research methods in a study on infant mortality. And we've heard this morning, it's linked very much to what Peter Beresford was talking about the need to engage communities, make voices heard that are underrepresented, and about really trying to use research as a way of doing that. So this research explored solutions to the much higher rates of infant death that are found within African and Pakistani communities in particular, as well as amongst certain other groups compared to the majority ethnic population. So just to say a little bit more about this actual method, participatory research is seen as the most ethical way of working with socially excluded groups because it models the more equal social relations that people within these groups generally don't experience. So, as researchers are saying, there ought to be more inclusion, more engagement, more attention to the needs of people within these groups. Researchers themselves need to actually model that. Often we find research not modeling what it's actually promoting. So participatory research is a way of actually doing that modelling and ensuring that the research itself is relevant to, in this case, the women who had experienced an infant death. So that they're not involved just simply as the objects of study, but actually as participants in the research process. As part of the study, we established what we called the HOPE group. So these were groups of bereaved women, women who'd actually experienced an infant death. They were women from Pakistani and African backgrounds, and they were supported to contribute to decision-making about maternity services. These women were actually underrepresented in decision-making amongst maternity staff and amongst commissioning groups and all the sort of major areas where decisions about the experiences that they would be offered were made. They weren't actually part of that process. So these HOPE groups actually enabled their voices to be heard. And as researchers, we facilitated meetings where the women could present their priorities, their solutions for what needed to change to reduce the rates of infant mortality in their populations. And we invited key professionals to these meetings so that they could then negotiate together, co-produce the solutions that would be feasible and seen as acceptable within health services and also amongst the women themselves. So this was really a co-production of knowledge about what might help reduce the higher rates of infant mortality and negotiated between these different stakeholders. And we concentrated on practitioners and policymakers who were willing to listen. There was some resistance, but rather than trying to open those closed doors, we created a momentum for change by working with really quite a wide group of practitioners who were very interested to know what women had to say and to try and build those into interventions in health services. These are some examples of what the HOPE group achieved as a result of the study. And they reflect women's greater involvement in decision-making and the development of more responsive care. Not just in the fieldwork site, but also nationally, there was a take-up of the ideas that the women put forward. And one of the things that actually happened that was really helpful was that the Chief Medical Officer's report on prevention of on actually care of children and better healthcare for children included the HOPE group as an example of good practice. And the change that was achieved was also greatly influenced by women presenting their own personal accounts at development workshops that we organised. In this next slide, which Naz has given me permission to share with you, she described her experience of a rushed admission following several attempts to be admitted for what turned out to be a premature birth. And women's personal accounts were always evaluated in the development workshops and the dissemination events that we held as the most powerful and appreciated aspect of these events, because they contained a kind of experiential knowledge, as Peter has pointed out, and the emotional impact of their personal stories was a really important reason for the changes that were achieved. The second approach I want to talk about is the use of a very well recognized process for developing health interventions, in this case for Muslims with depression. So the Medical Research Council has a framework for developing what they call complex interventions. It involves a robust and credible method for bringing together evidence from various sources, which can be from literature, from key informants, people who have experience and expertise in the area, to develop or adapt what is offered in healthcare services. And in our case, this included evidence of social exclusion and links with mental health and how to engage effectively with Muslim people with depression, something that really isn't covered at all in professional training. The pilot process in particular, phase 4 of this framework, involved training staff to increase their understanding of these issues. And the implementation process supported therapists to overcome their lack of confidence and challenge discriminatory processes that were operating within the healthcare setting of therapy services. So this kind of pilot study involved senior managers being supportive and promoting the new treatment, and involved practitioners in conveying a message of social inclusion, being more reflexive as practitioners, avoiding the stereotypes and accepting the legitimacy of Islam as a value framework, which is a really important message for service users to hear. It's a really important message in terms of them feeling socially included. The approach also meant that therapists were supporting clients to deal with adverse social circumstances that were stressors causing depression, and encouraged them to collaborate with community organisations to extend their own networks. So it wasn't all plain sailing by any means in terms of professional acceptance of this new approach, but the reasons for resistance themselves were important for us to analyse and look at in terms of how to get this new approach accepted, and how to overcome the inequalities and the dynamics that were causing exclusion. The process itself was very empowering to Muslim service users, who almost all gave very positive feedback about their experience of the pilot. And this kind of study, as people working in health services will know, can lead to much larger scale studies with more fieldwork sites delivering such interventions, which can then be evaluated and added to the evidence base. I'm going to pass on to Shenaz now, who's going to talk about her use of research in MEND.
I don't have a presentation. I'm going to speak from notes. I hope that's okay. I want to talk a little bit about modalities of men's engagement with research and the two streams in which we approach it. The first is to channel it, and the second is to challenge it. When I refer to channeling research, I'm talking about the way that we use research for advancement within the Muslim community. And ways in which we've used research for this purpose include literacy and skills development for Muslim communities. So we have a program of masterclasses on political literacy and religious literacy that we run for Muslim communities. It helps them understand the landscape in politics and media in the UK. It's devised to provide them with a set of skills to engage with representations of Islam and Muslims in the UK and of getting their voices heard in the public sphere, particularly in relation to politics and policy development. We've used the research for advocacy purposes, and this refers to the various consultations that we've engaged with at public policy level. I referred earlier to the Ruby McGregor-Smith inquiry into workplace discrimination, but other inquiries we've been involved in is the Home Affairs Select Committee Hate Crime and its Violent Consequences inquiry, previous inquiries on counter-terrorism, on airport scanning, body scanners at airports, etc. Perhaps one of the largest mechanisms for channeling research is through our documents that are released just before elections, local and national elections. And I'll give some very specific examples of how we've used research for this purpose. In 2012, when the Police and Crime Commissioner elections were run for the first time, we utilised existing bodies of data in relation to counter-terrorism policies and its impact on Muslim communities, on data collection in relation to hate crime and disaggregation of race and religion in police-recorded hate crime data, the crime survey for England and Wales, and we were utilising both primary research, that is the survey data itself, and secondary analysis, which is the output produced out of research academies in relation to all of these different issues. We put them together in particular manifestos. And for the Police and Crime Commissioner elections in 2012, we advanced as one of our key policy pledges the recording of Islamophobia as a particular category of hate crime in the same way that anti-Semitism is recorded in extant police recording systems. In 2015, that's 3 years after we started our own campaign, David Cameron announced that all police forces in England and Wales would now roll out Islamophobia as a category of crime and that this would now be reflected in national crime statistics. That's just one example of how we've had impact. The second I want to give bears quite directly to Leeds University because the person involved used to be Professor of Religious Studies here, Kim Knopp. She's now moved to Lancaster. When I attended my first meeting for REF for the 2014 exercise, there was a seat vacant next to Kim and I took it, and we got talking about the research that she'd been doing at Leeds University, and I was quite piqued when she mentioned religion and Muslims, and I'd asked her about her recent research, and she mentioned she'd just completed an ESRC project on portrayals of religion and the secular sacred. Out of that came a collaboration with MEND where we invited her to disseminate her findings at an audience in Westminster, and it later influenced the work that we presented to the Leveson Inquiry in relation to the media portrayals of Islam specifically. And outputs that have been generated out of that you can find in the Leveson Inquiry report, where there are about 8 pages that are devoted very specifically to the media's portrayal of religion, migrants, refugees, and the role of the media in bringing communities together, that is serving a function that is purposeful in a democracy. And it's also provided for Muslim communities, and this goes back to my point of channeling, it's provided Muslim communities with avenues of understanding how it is that low-level interactions with research and very direct engagement at an agency level of an individual who either communicates with newspapers at a local level or communicates with their MPs or communicates with their police and crime commissioner can actually agitate for specific change. The second stream in terms of how we engage with research outputs is challenging it. And I refer to challenging in both a positive and negative way. When I say challenging it, I'm referring both to the way that we engage with the research to probe new questions. That is, when researchers are presenting us with things that they've done in relation to Muslim communities, we're always examining what more can we ask, or what questions have not been explored, or what new questions emerge out of that research. And the other side of that equation, obviously, is utilizing research out of the academy to challenge research that influences policymaking, but whose provenance is of a more dubious nature.
Thank you very much. Thank you, both of you. And